just as a reminder, to everyone, these sessions are recorded from a presentation perspective so that folks can come back and review these videos. But once we get to Q&A, to make sure everybody feels comfortable collaborating and jumping in, we're going to turn off the recording. In the meanwhile, please drop any questions as we go through this into the chat so that we can make sure that we address questions as we go through the presentation. My part this afternoon will be about 20-25 minutes. And then after I am done talking about respiratory virus season, Claire has some great information for us on heat and smoke related stressors that happen around this time of year. So welcome to session 2 of our Infection Prevention Power Hour. And today we are talking about preparing for respiratory season. Okay, and again, please drop any questions, issues, or ideas in the chat as we go. And we'll deal with we'll touch bases with those at the end before Claire does her presentation. So when we talk about preparing for respiratory season, where we're focusing in on here is SARS-CoV-2 or COVID, influenza, respiratory syncytial virus, or what we call RSV, and also touching a little bit on the common cold, because that sort of is what we're presented with really in our formal respiratory season, but we've even had COVID happening this summer. So I always talk about how important prevention is. I much prefer being an infection preventionist than an infection control practitioner. So it's important to think about what those key elements of a proactive prevention program is. And for a respiratory illness, getting vaccinated is probably one of the most important things for you to get yourself vaccinated, and also your staff that work in your facilities. Also targeting, in particular, vaccination availability and access to the most vulnerable. And that is really our long-term care and skilled nursing settings. I encourage you to always be practicing respiratory etiquette as part of your foundation of your program, and then really normalizing hand hygiene. And I know that's a huge piece of what we do for healthcare workers, but it's also really important for our residents as well, because oftentimes they're touching a lot of surfaces, and then they touch their eyes, nose, and mouth, which is also a source for transmission. And then always keeping our hands around, or our hands-on cleaning and disinfecting surfaces and equipment. The other, I think, key element of your program is really being prepared and having a plan to respond once you have 2 or more cases. So, have that first case response plan. Checklists are helpful. Also, be aware of your local community cases, and I'm going to give you some resources for these as we go. You want to, based on local community cases, consider proactively implementing universal masking. When you see an increase in cases in your community, meaning your county, and work with staff to reinforce before you have cases what work exclusions are and when they'll be able to return to work. It's also helpful to identify those in your facility population who are not vaccinated, so you can perhaps take some additional protective measures for them. And most importantly, stay connected with with your local public health authority, because they're an important resource and reporting partner for you. I threw this in just because as we have all these, we continue to have these new viruses and challenges. It's a nice article, and I will send this out as a link in the follow-up email And just a good article from Christina Fiore, and talking about what respiratory virus do I have. So I wanted to start here by talking about some of the things that are important with flu, RSV, and COVID-19, but also the common cold. So it's important to keep in mind that our risk factors are age, so the very young or the very old, so less than 2 and older, 64 and old, so older than 64. Those who are residents of a congregate living setting, any congregate living setting will be a risk factor. Having underlying medical conditions or a condition and weakened immune system. Now, transmission of all of these viruses can occur either through inhalation of droplets or aerosol containing the virus. And so droplets containing the virus or aerosols. And it can also occur, and this is why hand hygiene for our residents is so important, by contaminated hands touching contaminated equipment and surfaces. And then, we go up and we feed ourselves with those contaminated hands or touch our eyes, and nose, or mouth. Symptoms, always think fever and cough and fever, or cough and a sore throat, or fever and a sore throat. And also symptoms such as body ache, runny nose, fatigue. And it's important because these are also symptoms that we can sometimes see with a common cold other than the fever. But the symptoms are typically more severe with flu, RSV, and COVID-19 than they are with a cold. Testing is pretty much the same as we've learned over the last couple of years. We collect nasal or throat swabs. So PCR or antigen tests. And then for people who are tending not to be managing what virus they're having, they have a chest x-ray and sputum test, maybe additional testing that is done. Prevention is really about vaccination, use of masking, so universal source control. I like to think about that as capping the source of that virus generation. So use of those good, well-fitting masks, hand hygiene, and again, surface disinfection. Treatment for COVID-19 is Paxlovid, and influenza is Tamiflu. And then also there may be additional treatment methodologies required as supportive care for symptoms, and then hospitalization for severe illness that occurs, such as with a lower respiratory infection or pneumonia. So I'm approaching this as really having an infection control toolbox that's targeting respiratory season. And I've listed these things that I'm going to be touching on. So quick references: vaccines, testing resources, social distancing, all of those. So we're going to run through that as we go. And I'm going to start with some very valuable quick references. And I will send links to these again in the follow-up email that I send out in the next day or so. So the first is this OHA document that was published, and it's the at-a-glance infection control for respiratory pathogens. And it essentially runs through the organism, what kind of precautions, what PPE should be used and when. And if you haven't already seen this, this is a really useful quick reference. So I would make sure you have this on hand as part of your toolkit. There's also the interim summary of long-term care facility infection control for COVID and other respiratory pathogens. And this is a co-branded document with OHA and ODHS. And it's, it's a 10-page, more detailed document that goes through everything from entry screening, visitation, PP requirements, return to work. So it is also a very well put together, useful resource. And then lastly, I would suggest that you include this document also co-branded between OHA and ODHS. And this is respiratory season guidance for admissions from hospitals to long-term care facilities. Lots of good information in this one as well. So I'll send out links to all of those. And of course, I want to talk about vaccination. So there are vaccines for flu, COVID-19, and RSV. And it's important to emphasize with the folks that we are influencing that, you are protected when you're vaccinated. You protect your family, friends, and loved ones. And you also, especially as healthcare workers, protect your vulnerable patients and residents. We know that vaccinations are well documented to prevent serious illness, hospitalizations, and reduce the risk of pneumonia, intensive care admission, and being placed on a ventilator. We have good evidence that these vaccines are safe, so sometimes we need to do some more targeted education as to what we've seen with these vaccines over the last several years. And that while we may experience mild side effects from the vaccination shot itself, these are minimal in comparison to serious illness. So tenderness where the shot was given, mild body aches, and fatigue. And then this is something that we talked a little bit about last month, and I just want to remind everybody or let you know if you weren't here last month, is that there are some vaccination resources that are available for long-term care residents and staff. And I know staff vaccination can sometimes be a little bit more of a challenge, but there is this vaccine toolkit, which I will also send out a link to. And sort of the lead for this is Ryan Frick, and he's a population health epidemiologist with ODHS, and has put together this toolkit and identifying resources for pharmacy partnerships and fee-free access for on-site clinics, and that's primarily through Albertsons, Kroger, Fred Meyer, and Rite Aid. So that's a really helpful toolkit to have in your toolbox. The other thing that's really valuable is being aware of what's happening in the community around your facility. And one really nice resource is this data challenge from the CDC. Data channel from the CDC. And this tool, which I've given you a screenshot on the right-hand side here, tracks national and state level spread of COVID-19 flu and RSV. It's really simple to use. I actually did this yesterday, never having really gotten into it before, but it is, you put in your state. So state of Oregon, I happened to go in to look at Multnomah County, and it aggregates the data or collects the data for visits to emergency departments and folks who are ill with those upper respiratory symptoms. And it shows here that in Multnomah County, a couple of days ago, flu was decreasing, RSV and COVID were steady, had no change, and basically really are remaining at this point are at levels that we saw really during peak season last year during the winter. So this is a really good tool for you and your team to use to get a sense of what's going on around your building. So another tool in your toolbox really is education. And this is the best time of year, honestly, to do, for instance, an infection prevention skills fair that covers those key elements of respiratory season, including PPE donning and doffing, hand hygiene, cleaning and disinfection, patient management practices, and improving indoor air quality. It's also important to review with everyone, even though we think they know it, is review those key signs and symptoms of flu, COVID-19, and RSV. Make sure your staff know what the sick policy is and what the return to work practice is. And also don't forget our residents and visitors in that educational opportunity. Universal masking is also an incredibly valuable tool. We know that wearing a mask lowers the risk of transmission and really protects us as healthcare workers from inhaling infectious particles that might be circulating in the area where we're working. But it's also important to choose the right mask for the activity that you're performing. You want a well-fitting medical mask. KN95 respirators are still indicated for care of someone who's symptomatic or positive for COVID-19. If you don't know which pathogen is causing that upper respiratory infection, treat it as if it were COVID. So the most stringent controls. Just a word about KN95s. They actually do provide a good fit, and in many circumstances, they are easier to use. However, they should not be used for the care of someone who's symptomatic or COVID-19 positive because it doesn't provide the same level of protection as an N95. You want to make sure that your folks, whether it's a staff or a resident, are wearing their masks properly and ensuring that it covers the nose, the mouth, and then and the chin as well. So we don't want it hanging below the nose or as a chin rest. Also ensure that folks are cleaning their hands before they put the mask on, after they take it off, and after any time after you've touched it with your hands. And then I also like to say, please avoid using masks with valves because sometimes those valves are pop valves that actually release air that you've exhaled through the mask. So in general, just don't use masks with valves. So a word about COVID testing. And essentially, we've got all these circulating viruses and, why is it important to know what it is? Well, our controls are more stringent with COVID-19, and that's why when someone is symptomatic, it's helpful to know the specific respiratory virus involved because it guides treatment and prevention choices. Antigen testing is useful for screening, but there's a higher false negative than with a PCR, and for that reason, repeat testing is indicated. PCR is more expensive than rapid antigen testing, so we are obviously seeing much less of that. As part of your toolkit, make sure you have those test kits on hand so you can begin testing when needed. And it's important to follow your local public health directions for testing, return to work, isolation, and any other infection control aspects that you're coping with. I put together, this is not branded by OHA, but I put together a respiratory virus outbreak best practices checklist. And I like checklists because it helps me keep kind of key elements that are really required to prevent ongoing transmission in sort of front and center. So I'm happy to share this. I'll attach it to the email. And basically it's, what are those key elements? What precautions do you implement? Notify your local health department, and how do you do that? What kind of PPE to use? How to stock isolation equipment, all of those kinds of things. So, having that checklist is always valuable for me. So if you like checklists, you'll have one that you can customize and put your own name on if it works for you. So the other important thing is that when you have a respiratory outbreak, and we define that as 2 or more cases in a long-term care facility, You must, the Oregon rules are that you must immediately report those outbreaks to your local public health. Single cases, however, of influenza, COVID-19, and RSV aren't reportable. And then the LPH will work with you to gather information on cases. They'll look at symptoms, symptoms onset, contacts, help you, tease out testing decisions and review your PPE supply. So they're a really important resource for you. And they'll also be looking at concern around factors in an outbreak, such as the facility setting, how many cases you have and how quickly the virus is spreading, the demographics of your facility, and the number of people exposed. So they're really active in what they're doing to investigate these outbreaks. And also they'll monitor and it's important for you to maintain that online case log in order to be able to track cases. Make sure you maintain regular communication about any updates, questions, and issues until your outbreak closes. And then why do we do all this? Well, it's really because Oregon Health Authority and the CDC, so statewide and nationally, we really need data to help us understand what happens during these respiratory outbreaks so that data drives a future public health policy. So that's kind of how it all comes together in the broader picture. Another tool in the toolbox is what we call social distancing. I don't particularly like social distancing as a term because we all really understand the psychological impact of social distancing. So I like to call it physical distancing because there's still a lot of ways that we can have those important social connections without increasing significantly our risk for transmission. So the World Health Organization uses the 3 C's. So avoid closed spaces, avoid crowds, and avoid close contact defined as less than 6 feet during periods of increased circulation of respiratory viruses. You want to avoid contact with symptomatic or positive individuals, especially unmasked. And then wherever possible, as part of prevention, move your gatherings outside into the fresh air. And then there's also some steps that we'll go through to improve indoor air quality, all which can reduce risk for viral respiratory transmission. Cleaning and disinfection is always a core infection prevention practice. So I can't not talk about it. Please remember that surfaces have to be cleaned first. If there's debris or blood or sputum on a surface, disinfection will not be effective. It's also important to use the right germicide. We know that list N, EPA list N for COVID-19, everyone is pretty much familiar with now, and then there's list K for C. difficile. But a best practice really now, and what I'm trying to drive for people is really to look at list, I said list N here, that's a typo, I apologize, list P for Candida auris. So to me, the most important ones are list K and list P. The other aspect to remember is it's very important to keep the surface wet for the required time. Always, when choosing a germicide, always think to shorter dwell times, which are better than long dwell or contact times. It's very hard to keep a surface wet for 5 to 10 minutes. So, really be thinking about how can I get my dwell time down to less than 3 minutes and have a good effective germicide. If you want to look up and you are not aware of it, you click on that list that you're looking at and put in the EPA number of the product, which is step 2 on the right, and it will tell you what the contact time is and if it's effective against the organism that you're trying to kill. Also, during increased periods of respiratory viral activity, consider increasing the frequency of your high-touch surfaces. I know CDC recommends daily, but during those periods, you might want to create it. You might want to increase it to, each shift or twice per shift, depending on the activity of your areas. But those high touch surfaces are your doorknobs, handrails, handles, light switches, grab bars, the arms of your chairs. But also, you really want to be targeting your medication carts, the tables and nightstands in the rooms, and any shared medical equipment. It can all be a source of hand contamination. The other tool in your toolbox is improving indoor air quality. So you want to now, before you actually have cases or starting to see cases, ensure that your HVAC system meets ventilation design codes. And a big element of this is really to dilute viral particles in the air. So you can do that by increasing the amount of fresh or purified air that flows into a room in those spaces. You want to make sure you're using MERV 13 filters. You want to make sure your facilities person is opening those outdoor air dampers to increase fresh air coming in, and also use windows and doors to increase outdoor airflow. I didn't put this in here, and the other step that you can take that's very valuable is where you have exhaust fans, such as in adjacent bathrooms, you can turn those on and exhaust contaminated air through that exhaust fan, and then pull in fresh air from the open doors and windows. I don't particularly like fans. If I had my way, I would say never use them, but they are necessary, especially in these intense hot periods. But never place your fans on the floor. You always want to direct airflow, and I mean where the exhaust of the fan comes along the floor. You always want to direct airflow from a clean space toward a dirty space. So for instance, from the bathroom area from the patient bed area toward the bathroom. And you want to avoid having fans blowing from one patient across to another. So place your fan either directly at the patient or where it is not going to blow across the patient in the adjacent bed if it's a semi-private room. And then we all have these HEPA filter units now, and they're wonderful. But as I've gone out to facilities, I don't see them oftentimes in those community spaces. So really look at those large areas where people are congregating. Your dining rooms, your TV sitting areas. And then when you use these in multi-patient rooms, place them between the beds, blowing out just like you would a fan, and not having them blow across from one patient to another. And lastly is, the other tool that you can pull out of your toolbox is to request an infection prevention consult with one of OHA's regional infection preventionists. We're not part of the regulatory branch of the health department. We're here to help. It's what we do. And I always like to say, infection preventionists, we go where the bugs are. So we're here to help and support you in controlling these outbreaks. So I just want to pause here and see if there are any ideas, challenges people are having, and look at the chat again. I don't see anything in the chat. Does anybody want to drop anything in here or unmute I'm going to turn it over to Claire for wildfires and heat-related illnesses. Are you ready, Claire?
Yep. Hi, everyone. My name is Claire Walker. I'm one of the regional EPIs at OHA. And today I was going to talk about wildfires and heat-related illness. Next slide, please. I can't see all of my presentation. Let me see if I can. Okay. So the bottom of my, is it okay if I share? Because I can't see like the bottom of my presentation. Here, let me see.
I'm sorry, I was having trouble finding my unmute button. Yeah, go ahead and share whatever is more convenient for you, Claire.
Okay. Let's see how to get this. Okay, can everyone see my screen?
Yes.
Okay. So if anyone remembers the 2021 Pacific Northwest heat wave, back in June of 2021 was record-breaking heat dome. Pendleton Airport hit over 100 5 consecutive days in a row. Portland International Airport 3 consecutive days above 100, and then Salem Airport reached 117. And then June 29th, Oregon tied its record high of 119. 123 people died in Oregon from the heat wave. Oregon, like the rest of the world, has been getting warmer for decades due to increasing greenhouse gases. As the climate continues to warm, the likelihood of a similar heat event will progressively increase. And this is a picture of blackberries damaged by the heat wave. Indoor shelter from heat can be compromised if AC breaks or power outages occur. Heat waves bring increased electricity demand, which can overload the system. Extreme heat has coincided with power outages in every US region from 2012 to 2021. These events can expose people to dangerous temperatures and amplify health risks during heat waves. Wildfires account for 39 power outages. Over half of them were in the last 5 years. About a third were wildfire public safety shutoffs or to reduce the risk of equipment-related ignitions during extreme fire weather days. Wildfire seasons are lengthening and intensifying across the US. And these are pictures of cables melting and roads buckling from the heat wave. Sorry, my screen keeps changing its slides. Extreme heat can affect anyone, but those most at risk are over 65, babies and children, pregnant women, those with existing medical conditions, certain medications, and those who are socially isolated or living alone. Heat can cause serious and potentially fatal health problems such as heat exhaustion and heat stroke, trigger sudden events like heart attacks or stroke, or worsen existing medical conditions like asthma and other respiratory illnesses and kidney and lung diseases. So heat risks in long-term care facilities. Although long-term care facility residents are primarily indoors, they are still at risk for heat-related illness. Older individuals and those with pre-existing conditions are at increased risk. Some long-term care facility residents are unable to communicate symptoms of heat-related illness, and some long-term care facility residents are unable to remove themselves from hot environments, and some long-term care facility residents don't drink enough water. So it's very important to stay hydrated. Dehydration escalates heat-related illness. Symptoms of dehydration include thirst, dry mouth, passing less urine than usual, dark or strong smelling urine, dizziness or headaches, irritability or difficulty thinking clearly. And first aid for dehydration due to heat is to move the individual to a cool area and rest, drink plenty of fluids, remove unnecessary clothing, cool down by wetting the skin with cold water, and see a doctor if there is no improvement or you are concerned. So types of heat-related illness. Heat stroke is the most serious heat-related illness. It occurs when an individual can no longer control their temperature. Their body temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. When heat stroke occurs, body temperature can rise to 106 degrees or higher within 10 to 15 minutes. Heat stroke can cause permanent disability or death if the person does not receive emergency treatment. Symptoms of heat stroke: confusion, agitation, altered mental status, slurred speech, loss of consciousness, hot, dry skin, or profuse sweating, muscle twitching, seizures, rapid breathing or rapid pulse, very high body temperature, and possible death if not treated quickly. Sorry, my PowerPoint is acting up and refusing to switch slides. Okay, heat stroke first aid. Move the individual to a shaded, cool area and remove outer clothing. Wet the skin, soak clothing with cool water or ice bath. Circulate the air around the individual to speed cooling. Place cold, wet cloths or ice on the head, neck, armpits, and groin. Give cool water to drink if they are fully conscious and able to swallow. Position an unconscious person on their side and ensure they are breathing normally. If needed, perform CPR. Call 911 for emergency medical care and stay with the individual until emergency medical services arrive. Heat exhaustion. The body's response to an excessive loss of water and salt, typically through excessive sweating. Heat exhaustion is a serious condition that can progress to heat stroke. Heat exhaustion is most likely to affect those over 65 years old, people with high blood pressure and other pre-existing conditions, and individuals in hot environments. Symptoms of heat stroke or heat exhaustion include headache, nausea, vomiting, dizziness and fainting, weakness, muscle cramps, irritability, thirst, heavy sweating, elevated body temperature, decreased urine output, pale skin, and rapid pulse. Heat exhaustion first aid includes having someone stay with the individual until help arrives, remove individual from hot area and lay them down and give them a drink, remove excessive clothing, including shoes and socks, cool the individual with cold compresses or have them wash their head, face, neck, groin, and armpits with cold water and fan continuously. Encourage frequent sips of cool water. Take individual to the clinic or emergency department and call 911 if medical care is unavailable. Rhabdomyolysis, or also known as rhabdo, is a medical condition associated with heat stress and prolonged physical exertion. Rhabdo causes the rapid breakdown, rupture, and death of muscle. When muscle tissue dies, electrolytes and large proteins are released into the bloodstream. This can cause irregular heart rhythms, seizures, and damage to the kidneys. Symptoms of rhabdo include muscle cramps or pain, abnormally dark tea or cola-colored urine, weakness, exercise intolerance, but they can also be asymptomatic. Rhabdo first aid includes stopping any activity, drinking more liquids, preferably water, seek immediate medical care, and then checking for rhabdomyolysis with a blood sample. And there's more information on NIOSH's website. Heat syncope, a fainting or syncope episode or dizziness that usually occurs when standing for too long or suddenly standing up after sitting or laying down. Factors that may contribute to heat syncope include dehydration and lack of acclimatization. Symptoms of heat syncope include fainting for short durations, dizziness, lightheadedness from standing too long, or suddenly rising from a sitting or lying position. Heat syncope first aid includes sitting or laying down in a cool place, slowly drinking water, clear juice, or a sports drink. Heat cramps usually affect individuals who sweat a lot during strenuous activity. Sweating depletes the body's salt and moisture levels. Low salt levels in muscles cause painful cramps. Heat cramps may also be a symptom of heat exhaustion. Symptoms of heat cramps is muscle cramps, pain, or spasms in the abdomen, arms, and legs. And then first aid for heat cramps includes resting in a cool place, drinking water, or having a snack or a drink that replaces carbohydrates and electrolytes, such as a sports drink, and doing that every 15 to 20 minutes. Avoid salt tablets and get medical help if the individual has heart problems or is unwell, is on a low sodium diet, or has cramps that do not subside in 1 hour. Heat rash is an itchy skin irritation caused by excessive sweating during hot, humid weather. Usually occurs on the neck, upper chest, waistline, groin, under the breasts, and in the skin folds of elbow creases and armpits. Symptoms of heat rash include redness, red clusters of pimples or small blisters, mild swelling, and itching or prickling sensation. Symptoms of heat rash can last for several days. Heat rash first aid includes moving the individual to a cooler, less humid environment, keeping affected area dry, wear loose fit cotton clothing to help prevent overheating and avoid scratchy fabrics which irritate the skin. Don't use ointments or creams, and a clinician or pharmacist can recommend treatment to ease itching and inflammation. Heat rash normally goes away without treatment. And then how to stay safe in extreme heat. So it's really important to keep cool, use AC and fans, keep skin wet using spray bottles or damp sponges, soak towel in cool water and wrap loosely around your head, take cool showers or foot baths, wrap ice cubes in damp towels and drape around your neck, wear light and loose fitting clothing, use blinds and curtains to block sun from windows, and open windows and doors only if it's hotter indoors than outdoors. And stay hydrated. Keep drinking water before you feel thirsty, especially if outdoors and performing physical activity. If your doctor has asked that you limit your fluid intake, ask how much water you should drink during hot weather. Always have water with you and watch for signs of dehydration. Plan ahead. Cancel or reschedule non-essential activities or outings during extreme heat. Plan essential activities for the coolest part of the day. If you have to go outside, have a water bottle, seek shade, and wear a hat and sunscreen. Know weather forecasts and warnings. Keep food and medicine stored at appropriate temperatures. Check with physicians if changes are needed to medical care during extreme heat and medicine. Check that fans and AC are working in advance before a heat wave. And have a detailed heat-related emergency plan for your facility. That's very important. Be prepared for power outages, have fully charged electronics or battery backups, a cool box to store ice or cool packs with medications. And then ways you can make your building cooler in advance are installing reflective coatings, insulation, glazing, external window awnings, shade cloths or external blinds, plant trees to shade the building. Then wildfire heat related health effects. Wildfire smoke can cause headache, irritated eyes or sinuses, irritated throat, coughing, difficulty breathing and wheezing, increased fatigue, asthma and other lung diseases can be aggravated, bronchitis, reduced lung function, chest pain, heart failure, heart attack, and stroke. If wildfire smoke is impacting air quality, be sure to stay hydrated. Those particularly susceptible to elevated air pollution levels during smoke events are those over 65 years old, pregnant women, babies and children, and those with respiratory illnesses and other pre-existing conditions. How to prepare for wildfire smoke. So weatherizing buildings, replacing, refurbishing old leaky windows and doors, and use caulking to seal openings. Have non-ozone producing air purifiers like HEPA filters or MERV 13 or greater filters for HVAC systems. Have a HVAC system that allows both heating and cooling with recirculation to prevent smoke from entering the building. Individuals with health conditions should develop personal plans for smoke with their physician in advance. Make plan to go to a cleaner air location if unable to seal the building or if dense smoke occurs during hot weather events, only if possible. So what to do during a smoke event? Leave affected area if possible for the duration of the heavy smoke event. Stay indoors with windows and doors closed. Keep air cool or visit a cleaner air cooling center. Set AC to recirculate to prevent outdoor air from moving inside. Masks are not a substitute for staying indoors. Bandanas and surgical masks do little to protect against wildfire smoke particles. And these are some links to air purifiers, and make your own air purifier. And then for more information, you can visit the Oregon Health Authority's Environmental Public Health website. If you just Google environmental or Oregon Health Authority Environmental Public Health, this website should be the first one that pops up. And then that's their phone number if you have any questions. And I can't see the screen, so I don't know how much time we have left. Do we still have any time?
You know, Claire, we're down to about 5 minutes.
Okay.
We can touch on some of these questions, but I just did want to mention a couple of things before people start jumping off the call. And that is that next month,